there's great evidence in the scientific literature, evidence-based, that you can kill various types of cancer cells in animals and in petri dishes. And even in animals, solid tumors you can inject, solid tumors tend to be difficult because they're sort of got, the outside, they've got encapsulated, and the tumor cells deeper inside are harder to get to. Well, you can inject, and these exosomes will do their job, and they don't harm normal tissue. So that's the beauty of it. They're selectively
They're completely selective. Wow.
So we've got those. We're going to look at it to help as an alternative to treatment, as an augmentative treatment if someone is having maybe chemo and radiation, they want to add something. And then maybe as a preventative, people at high risk, maybe their parents had cancer, maybe they have BRCA gene, maybe they had cancer years ago and they're checking every year and they want to help prevent it.
To make sure, it doesn't come back.
And then one study showed that these in humans, NK cells, not their exosomes, if you give NK cells to patients, and you can get NK cells in some clinics, mostly outside the US, those NK cells will help improve the age markers, blood tests on those patients, make them appear younger in their blood tests. So we know they have benefits. So skipping ahead to the exosomes has benefits because the exosomes travel better than cells do throughout the body. And the exosomes, the NK cells require to be activated.
All right. Welcome, everyone, to the 16th episode of the Rise 41 podcast. Today, I'm always your host, Gonzo Herrero, but today I have the privilege of welcoming Dr. Jeff Gross. He's a neurological surgeon and founder of Recelebrate. He specializes in regenerative stem cell medicine and anti-aging therapies. He completed his medical training at George Washington University and UC Irvine, followed by a fellowship in spinal biomechanics. He's recognized as one of the top neurological surgeons since 2020. Dr. Gross frequently speaks internationally on biohacking, which is why he's here to show us all about it, and stem cell topics. So let's dive right in and welcome Jeff. I'm not going to call you Dr. Gross.
Right. Thank you so much for having me. I'm happy to be part of the early part of this growing podcast for you, this biohacking movement. Number 16.
Yes, sir. Let's see if we can show some people what the exciting possibilities that are out there. Most people have no idea what we can do and what we can achieve. And hopefully you can shed some light into some of those possibilities. So go ahead, tell us a little bit about yourself and about your practice, if you would.
Yes. Well, I was a traditional neurosurgeon practicing mostly spine care, neck and back pain, disc problems, pinched nerves, injuries, age-related problems, all kinds of things. And, I was always trying to keep my patients from having surgery, right? Try everything else. And some of them would say, well, doc, how about stem cells? Let's try that first. And luckily I have some background in that in my undergraduate days. And, at some point I said, let's see what's happened in all those years since I had that training. So instead of going to the annual spine surgery, meetings where you hear about the same thing over and over, I started going to stem cell meetings. And this is about 6-7 years ago. And it reopened up, I should say, a whole new world of health and wellness and biohacking and things. And I did it to help my spine patients, but I do so much more now outside the spine because you can't, offer this just to the spine patients. That's not fair. Right. So I really have a focus on regenerative medicine, which is based in stem cells, stem cell derived exosomes, which we can break down if you like, and all kinds of things, peptides. But we also do all of the aspects of anti-aging, hormone optimization and lifestyle management and all kinds of things, testing, biological age testing, all things to really help people not only meet their healthcare needs, but their healthcare goals, which your regular doctor won't talk to you about.
So if the focus being on not just being okay and healthy, but actually to optimize yourself, to have the best life experience and quality of life you can possibly have.
Yes, that, and it's probably the best preventative thing you can do, and to slow disease formation and slow the aging process of your cells, which slows your aging process, which portends to a healthy longevity. What you do now is going to affect you in the next decade or so. So the best time to plant a tree was 20 years ago.
Right. Right. So that's the thing. What we do now will resonate as we go forward in time. Okay. So this makes perfect sense. And would you, just to give the audience again a baseline understanding, a lot of the work you do involves peptides are everywhere now. Everybody's talking
Yeah.
about them. So
Yeah.
maybe we can talk a little bit about what they are in your context, as well as perhaps bioregulators, just to have the start of a conversation, perhaps.
Yeah, we throw around the word peptides. They're very cool and therapeutic, but our body's always using peptides, which are small protein fragments. So, you think about things our body makes, or we use as supplements like melatonin.
Mhm.
You think about insulin. You think about the endorphins. When you're happy, you release endorphins.
Right.
These are all peptides, and peptides have far-reaching signaling capability in our body. Bigger proteins have functions where the smaller peptides are usually more signaling. They're
Mhm.
waking up a process, turning on a gene pathway that we have that might be dormant, influencing a cell behavior to do something different, which is called epigenetics. And a
Okay.
lot of lifestyle things we do influences our cells through these small peptides. Let me give you an example. High intensity exercise in the muscles releases something called myokines,
Mhm.
and those are small peptides that can stimulate all kinds of healthy activities in the cells of the body. It's even some in the brain that help stave off dementia. So peptides in our body are so important. But as we age or as we have issues, sometimes it's a cheat or a strategy or a biohack
Mhm.
to use peptides in a therapeutic way, give them back to your body. And this could be, something that releases growth hormone. It could be a healing protocol, like a Wolverine protocol with
Mhm.
body protection compound 157, TB500, copper peptide. It can be a bioregulator, which is even a smaller peptide that usually regulates some of the glandular activity. And glands are also known to release their own peptides. So it's sort of working your way up the food chain of activity in the body and in the cells.
Yeah, and the amazing thing is once you start looking into it, it's the sheer variety of processes and effects that one can achieve when
Right.
using what with a good practitioner like you leading the way. Uh, I'm an example. Like I had a torn rotator cuff. I was told surgery, did PT, did the infamous Wolverine protocol with TB500, BPC 157. MRI confirmed it's gone. It's perfect. It's good to go. So, I mean, these are things that I think a lot of people think that there's a little bit of potential placebo effect in some of the things that we do. But when you see the evidence and it's medically evidence based that there are results, I mean, there's something here. There's absolutely something here.
Yeah, we're learning more about, microscopic biology in a way now we can use it to our advantage. So that's grown since my undergraduate days. And that's what biohacking is all about because, health insurance don't want to pay for these cutting edge
Right.
treatments.
Right.
So you have to seek them out. You have to find someone to coach you on them, the right kind of clinician, and don't take no for an answer. If surgery is the only option you're given for a bad knee, then you're not asking enough people because we
Right.
have options, and that's what we do. Most of my practice is still spine and joints and structural parts, where we take people that are facing a knee replacement or something like that, and we help give them an option to try to avoid that. And so far, knock on wood, we've been amazingly successful, and
Okay.
I'd love to do more of it.
So would this be like stem cell regenerative? This is like that side of the house.
Yeah.
And for example, could this help somebody like you said, like an acute injury, like again, in my example, rotator cuff tear or a knee that's maybe torn ACL, things of that nature?
Oh yeah. I mean, we do acute injuries. We do, chronic degenerative processes called osteoarthritis or
Okay.
chondromalacia, which is all part of the same process where you can't maintain the cartilage in that joint anymore. You can't lubricate it. You can't make those cartilage proteins. There are ways we've learned to turn them back on. Now, I didn't invent this. I
Uh,
took from the best practices, the best evidence-based medicine out there, and I pulled the best of the how do you do it, what's the best thing to use, how do you apply it, how do you target it. I put all those together, and that's where we came up with our approach. Other approaches may work too. I'm not going to
right. Not gonna throw up
advertise,
the
oh, I'm the best, but but I trust what we do, and we have the results to back it up.
Okay, so let's talk about services that somebody could find at Recelebrate. So, for example, anti-aging protocols. Let's talk a little bit about that because that's always exciting to everybody.
Yeah.
Can you perhaps give somebody an understanding of especially in this world of Brian Johnson, where he's doing like
Yeah.
all the crazy $20 billion therapies? One of the
Yeah.
things that I would like to do with this podcast and with people like you, experts like you, is to make people understand that you can take a lot of approaches that are actually affordable and repeatable and accessible if you ask the right questions and the
Yep.
right people.
Yeah.
You don't have to spend $20 billion to stay healthy, vibrant, young, energetic. I'd love to hear your thoughts on that. What would you advise perhaps a patient that comes to you? I'm in my 50s, I'm achy, I'm not in the best shape. How would you approach that person?
Well, everyone's approach is an individual, because what's right for one person may not be the right for someone else. But we like to start at the beginning and break down your whole life. So what's your diet like? What do you eat? When do you eat it? What are your macros like? How good is your protein source? How good is the food you're eating? Are you eating inflammatory things? Are you allergic to anything? Then we look at gaps in the diet. What's your supplement stack look like?
Right.
What does your body need? We might look at lab tests to see what certain things are. And then we make sure you're on an anti-inflammatory supplement stack at minimum, that you're supporting your gut biome, that you are, if you have goals of maintaining muscle mass, we're on the right protein and protein content as a percentage. And then we look at sleep. We look at breathing, exercise. Are you efficient with your exercise? Is it moving the needle? What's your body composition? Are you overweight? Are you having trouble with insulin resistance? Why is that? Let's study it. Do you need short-term GLP-1, long-term microdose GLP-1?
Right.
You might use peptides in that. We will look at your hormesis game. Hormesis means a slight bit of stress in your cells to build resilience. Do you hot sauna? Do you cold plunge? Do you fast? Do you do a 3-day fast or a 1-day fast? Do you do high intensity exercise? Things like that. And then we go through the whole thing, and then if that is not completely helpful, then we talk about adding regenerative medicine. We tend to leave that last because we get the most out of it if your body's optimized. If you're right.
Right. Let's talk about that, because I think a lot of people read or hear stories like mine and what you've shared, and then they think, oh, wow, silver bullet, I'm going to take some Epidolon and I'll be like 20 years younger tomorrow. And that's not how this works.
No, and listen, the better your anti-aging results are, you start early and do it often, do it for a long time, and be patient. And some things you don't feel, like you take supplements, you don't feel them. You take some peptides, you may not feel it, but we could probably measure lab tests showing the benefits. And we see that too sometimes with the regenerative medicine that we do. So, and we want to optimize, if I didn't mention already, hormones as well, men and women. And that's not just for women. It's not just to prevent the symptoms of menopause. It is to help long-term anti-inflammatory benefits. It is to help prevent dementia, cardiovascular disease, bone loss. And we know that bone density and muscle mass are associated with longevity. You need to have those. You need to keep moving. If you could do just one thing, cost you nothing. Brian Johnson is wonderful. He spends a lot of money. He's pushing the envelope, but you want to do this on a budget? Exercise. High intensity, work to failure. It's at that last hardest rep where you're getting most of the benefits. And so that's how we approach the individual. We might modify what they're doing in different ways compared to someone else. And then we look at regenerative medicine. Is this someone who's got inflammatory burden? Because as we know, inflammation is the degradation of the cellular activities in the body. Right. And the faster you accumulate chronic inflammation, the faster you age, the more likely you have disease, the less likely your stem cells are as effective. And that's where we sometimes get help from a youthful source of stem cells or stem cell biologics donated, after a mother gives birth successfully by C-section.
Right.
They donate the materials, the umbilical.
Right, so ethically sourced, so people don't have that moral issue, which is understandable.
Right.
you know?
And I think a lot of that moral stuff is basically mythology. I don't think I've never seen it, heard of it, except when people ask.
Yeah.
So yeah, it's all super ethically sourced and tested and screened. And when we use it, we feel safe. I use it on myself, family,
Right.
friends. Yeah.
Yeah, and another thing that I wanted to mention is maybe it's because of the allopathic healthcare system that we're in, but I don't think a lot of people that are new to this are aware of the incredible synergy of all of these things. Your hormonal balance, like you mentioned, being insulin controlled,
Right.
having the hormones being at the right place, the connection between your gut and your brain and your biome, all of these things, they all literally play with each other and bounce off each other in a very complex dance. And this is where you come in, where you can help somebody, as well as the behavioral side of it. Like you said, exercise is technically free. It's the world of the internet. You can find a workout. You can like literally Google, give me a workout and find something to do. I find the biggest challenge for a lot of people, just to share my story a little bit with you, to give you some context. About 8 years ago, I lost 80 pounds. I used to be huge, inflamed, just not happy. And I
For
did the
you.
diet and weightlifting approach, which at the time, there was not a lot of people except the gurus like you knew about, right? It wasn't as widespread now, which I think is great, by the way. That's one thing that social media has done that is awesome, that the message is actually out there if you look for it. But that's how I ended up coming down this path, right? Of like, ooh, what else can I do? What else? What else? I feel great. What is the next step in that optimization?
Right.
So anyway, so the behavioral piece, I think, is the hardest one for people to like get into those good habits. Like you were talking about the protein intake, what is your stack that you need? What are you deficient in that you need to supplement? That kind of stuff. So how would you work with somebody? You have the knowledge, but how can we work with somebody to then start developing those behaviors? Is that something you can work with?
Yeah. Well, yeah, it's about I think data and accountability. So, for
Okay.
example, let's take diet. Okay, we're looking at you're not getting enough protein, you're not going to get the muscle gains even if you work out. We would start with an app, maybe on the phone, to track the macros during the
Nice.
day.
Okay.
Some of them I think have a picture. You take a picture of what you're eating, and it tells you what it
Yeah, it's
thinks.
not like the
Yeah,
world of before where you had to like type
yeah,
everything
yeah.
in.
So it's having a standard piece of chicken and some broccoli, whatever. It'll calculate the average macros. And then you could say, oh, wow, yeah, I'm not getting enough protein. So, okay, how do we supplement that? What's a good protein source? What's a
Right.
good amino acid breakdown for someone? How much
Mhm.
creatine is in it? There are all kinds of different subtleties we may look at. It may be different from, a young man versus an older man or a woman, or
Right.
some people say, I hate that. We might find a strategy to do it. Like, okay, we'll get the pre-made protein supplement shakes from the store with the low sugar. There's a way to do it for everybody. And then there's accountability. We have to track it. So
Right.
we want to be able to, it's like, have results. Okay, give me your average macros for the week. Okay, let's look at those results. Because, when people see, oh, this is working for me,
Right.
and they have that number, they have a target to shoot for. So it's like they know how to win that game. You got to kind of
Yeah,
gamify it.
yeah. And it's so hard sometimes to quantify how much better you feel when you practice these things. That's the other thing. It's become really hard, and I've tried to learn how to communicate that to somebody when they go like, "Man, you look great." And if you only know how I felt, it's even better. You know?
Yeah,
Um,
there is no good scale for that, despite our efforts to look for one. It's
yeah,
hard. It's hard, but
yeah,
we have
absolutely.
some great metrics now. You're wearing an Apple Watch, I believe. Is that what that is on your wrist?
Yes,
Yeah.
absolutely.
So you can track HRV now on your Apple Watch,
Hmm.
your Oura Ring, your Whoop Band, your Garmin device, what have you. So these are great way. HRV will be a great simple metric. You don't have to track
Right.
30 different things, right? HRV is probably the single, common denominator of a lot of
So
things you might do.
HRV meaning for the audience?
Heart rate
Okay.
variability, which is
Hmm.
the variation in between beats. So when the doctor takes your pulse over 30 seconds and multiplies it by 2, that's your beats per minute. It's an average over a minute. But we actually benefit from the heart that can be very adaptable, nimble on its toes, and can change quickly.
So like from rest, maybe 55 beats per minute, but then you can sprint and hit 140. But
even better than that, it's in between each beat. So
it's at that level.
60 beats per minute, that means you have 1 beat per second. Right. So what if you had 0.97 and 1.02 and it kept jumping around? You want that
adaptability.
Yeah, that speaks to the cardiac, the brain, nervous system, the autonomic nervous system talking to the heart, and the heart being able to react like an engine where you touch the gas and it goes.
Yeah.
You pull off, and it's a very sensitive.
This is great. I never had it explained this way. Yeah. This is awesome.
Think about this, Gonzalo. You have a zebra, and the zebra is resting. He's eating some tall grass, chilling out, relaxing. His heart slow. All of a sudden, a lion starts chasing him. He has to go from total relaxation, like waking up in the morning, and all of a sudden, just a full-on high performance, flat out sprint. Okay. Yeah. So that heart has to be able to adapt. HRV is sort of a measure of the heart's ability to do that. And then the lion breaks off the chase, and the zebra can't stay stressed for hours. That's not good for you.
Right.
Yes, audience, please read into the stress. Yes. And then the zebra has to then, I'm just going to go chill out, relax, and eat some grass. So he goes right down to a relaxed state. That's the heart's nimbleness, adaptability, and that's what HRV is all about. You can find it on your Apple Watch in other health data in the health app.
Gotcha. And, nowadays we have such a multitude of devices, which, by the way, I assume you encourage people to use. There's more data, more things Aura rings, I guess, just off the top of my head.
And
there's Garmin watches, all that.
I'm testing out a new ring called Velia.
Okay, cool.
So it has more sensors. I'm actually wearing the sizer just to make sure I got the right size. So that's a new one I'm going to be checking out if you're looking for a new one. And then, you don't want to wear 20 different devices. You'll just go crazy. But, pick one that works for you and put that to use. So that's really interesting.
Yeah, the ring, by the way, is something I'm about to pick up. I haven't picked one up yet, but I will. Now that you mentioned that, I'll definitely be checking through the Velia ring because of the sleep factor. Like, I can't sleep with a watch on. It'll drive me crazy.
I agree with you there. And I don't like the electromagnetic waves under my pillow. So I put this on my nightstand at night, and I use a sleep app that listens to me and gives me the sleep score. And it's got a really cool feature called a cough map. Okay. And if people who use that app anywhere I can zoom in or zoom out on the map, anywhere in the world, if they start coughing more than the average cough at night by listening to it, it'll be a red spot on the map. And I could see, there are people sick in the north of my city. It's working its way towards me.
That's crazy.
Vitamin C, you can, and the HRV data on the Oura Ring, I don't know if Velia has it yet. I don't know their app. That data, you can actually see if there's a dip in a geographic area.
Interesting.
Where people are getting sick, because a dip in your HRV is a sign of sickness before you're actually symptomatic with the sickness.
That something's about to happen.
Yeah. Because you think about it, you get a virus, it incubates in you. There's a day or two where you're not sick yet. Yeah. Well, HRV will change. It's so sensitive. So you can, echinacea, zinc, vitamin C.
You can be preempted.
Extra rest, stay away from people. I mean, you can really be smart about what you learn from that data.
That's amazing. So let me ask you, kind of in topic, but changing the topic a little bit. Another interest I have, and that a few of my audience have reached out to me, is the realm of cognitive enhancement, or I guess nootropics.
Yeah, nootropics,
For example, I have a son who has Down syndrome, who is doing great. He's very healthy, but of course, anything nootropic, I'm already interested. Are there any cognitive therapies, peptides, bioregulators, anything
Yeah.
that excites you in
Yeah.
the cognitive field that you could like maybe give us an idea?
Yeah, I'm a big fan of cognitive enhancement and nootropics and biohacking. If you're in college and you're studying for a test, you could take a dose of Zofran, which is anti-nausea medicine,
Uh-huh.
and its generic name is ondansetron. And
Mhm.
ondansetron is a cognitive enhancer. You will remember things better if you are on ondansetron at the time. So
Really?
yeah,
Okay.
so you
Oh,
can
that's
you can
awesome.
learn
So
to
you're
use them.
studying.
Yeah.
Take this.
So other things that there are some slight neurostimulants you can take, like we all take, not we all, many people take caffeine in some form,
Yeah.
or
Super
caffeine
common.
metabolite.
Hmm.
We metabolize it at different rates. So some people are, bright-eyed and bushy-tailed afterwards, and then they crash in the afternoons.
Right.
Some people metabolize it slower. They don't crash because it gets metabolized in there's something called paraxanthine, and paraxanthine you can also buy separately, or there are drinks, energy drinks with paraxanthine. Some of the peptides and some of the amino acids actually have nootropic effects, like
Oh wow.
taurine. Taurine is one of them. A lot of the energy drinks, not that I'm fully advocating them, because
Hmm.
some of them are a little too crazy. But
Yeah.
the taurine is probably very good for that. You can go into regenerative medicine. We could talk about besides peptides like we just did, or tesofensine, which is another peptide you might use.
Uh-huh.
You can talk about we use stem cell derived exosomes. Exosomes are the small signaling factors. We have wonderful examples of benefits in autistic patients
Hmm.
using them. They can be delivered to the brain through nasal spray or intravenous.
Wow.
They will cross the blood-brain barrier where stem cells will not. So
Right.
this is something we can do. And then just doing a lot of hormetic activity, exercise,
Hmm.
hot sauna, and I'm not talking about the infrared sauna. I'm talking about hot sauna, 175 degrees plus
Right.
for 20 to 25 minutes, 5 days a week, just like they do in Finland. These are where
Hmm.
you get the health benefits, including brain, and you stave off dementia. So those are the kind of approaches I have. There are many nootropics. You could take other anti-inflammatory and antioxidant
Hmm.
molecules like C60,
Right.
fullerenes, and you could, there are many ways. There are so many, where do you begin? You got to
Right.
find one
Right.
and try one at
Well,
a time
no,
and see what
even
works for you. Yeah.
the what's oh my goodness, what's his name? Our new Secretary of Health,
Robert F.
RFK.
Kennedy Jr. Yeah.
There's that infamous picture of him taking methylene blue, which is
Methylene blue. There you go.
yeah,
Mitochondrial. Well, methylene blue, as you know, is a mitochondrial support.
right,
So you got to take care of our mitochondria, not just in our brain, but throughout our body, especially our muscles, right? There's so many.
right.
But mitochondria, take care of your cell within a cell. The mitochondria, they'll take care of you.
Yeah, the you should comment about that for the audience, like their understanding, like the powerhouse of the cell, and I've researched. I think that's the right way to say it for YouTube. I've researched, for example, SLUPP 332,
Yeah, yeah.
extremely
That's right here.
successfully. Yeah, there you go.
I've been trying
That
that
is,
out.
yeah. Have you tried it yet?
Yeah, I've
Have
been using
you?
it. So, yeah, by the way, I do try a lot of these things. I'm not just the Recelebrate doctor. I'm also a customer. So I'm
Yeah.
always trying these things. And yeah, and I'm not sure I've noticed a difference yet. I've played with 1 capsule, 2 capsules. Now, I'm
Mhm.
not a huge fan of oral peptides
Right.
because they get
Right.
digested, right? So amino acids
Mhm.
get digested. So, for example, when I take I take a bedtime peptide you've all heard of called melatonin.
Right.
Um, I get a dissolvable so that at least it gets absorbed under my tongue.
Sublingually, is that the
Yep.
idea? Okay. Yeah. Yeah. So for sure, that's something like my first foray in this field was oral BPC 157. So I noticed, for example, my gut got better,
Yes.
but my inflammation overall and all that didn't really work. Then I tried, of course, the injectable, and that's what helped heal my shoulder and all those. And it
Yeah.
was incredibly noticeable. Same with SLU. SLU combined with diet and terzepatide. I mean, for the first time in my life, I mean, again, exercise on point, diet on point, etc. But I hit 10% body fat at age 53, which is
Wow.
insane,
Yeah.
within like a couple months. So all of these things, again, it's the synergy, but One thing that I love about your message is that you're telling people you still have to do your homework though. It's not the bullet. It's not magic.
No, I know we have a society that wants the quick fix, but
Uh-huh.
the quick fix is hurting us. The
Yeah.
quick meal at fast food is hurting us. The quick, I admit I go there sometimes when I'm in a hurry.
Hey,
But
food is delicious.
well, it's quick, it's easy, right? You pick it up,
Yeah.
you eat it. So
Yeah.
but we need to eat better. We need to do the work, and we'll get the results if we put the effort in.
Yeah, absolutely. One thing that I would like to get your thoughts on, I'm pretty sure I know what you're gonna say, but it bears repeating for the audience. If you're doing the GLP-1s, great tools. Literally, I've seen people who have rewired their relationship with food
Yep.
by using them in moderation. Just that food noise, that mental food noise literally disappears and they start making good choices, which is incredible.
Yep.
But of course, like you said, then there's the people that want to do 10 milligrams off the bat. And then, they do lose weight, but with that fat goes the muscle. And then we know what happens afterwards.
Yeah, you got to work on the muscle maintenance, and that requires exercise, protein, and not overusing the GLP-1 as you're losing the weight. I agree with you. Yeah.
Yeah. Another thing people
for a male might be part of that. Other hormones and maybe testosterone in women.
Yes.
And it's okay to start replacing your hormones as they're declining. We love to catch the women right when they're entering premenopause, not menopause. We've missed, because menopause is probably a years-long process.
Mm-hmm.
They call it premenopause, and you got to catch it early. And just like the men, you start just a little bit of testosterone, maybe in the late 30s or 40s.
Right, and that's another thing that we need to share. I had last week, that episode is going to come out tomorrow, as of the day of this recording. An incredible conversation with a gentleman named Big Paul, who's an enhanced bodybuilder, and he was very clear that there's a line of demarcation between true hormone replacement, testosterone, optimization, like what you're talking about, versus that enhanced and going past that into the super physiological, and how then performance may increase, but your longevity will not, because at some point there's that divergence. There's that you're running the engine at 12,000 RPM.
Right.
So
that's a very good point. Yeah, too much is a problem. You got to get in balance for optimization. I agree.
Yeah, absolutely. So let me ask you, exciting things that you are looking at that you might want to share with the audience, things in the horizon that might be exciting. Anything come to mind?
Well, I do a lot of work with stem cell derived exosomes. We take people with joint degeneration, spine degeneration, cartilage loss, osteoarthritis, even bone on bone, and we help them, save that joint and help keep them, delay and even maybe prevent the need for joint replacement or spinal surgery. So that's
pretty exciting, actually.
Yeah, we've been working on that. We have some before and after MRIs where we show return of the cartilage and all that stuff, and that's something we're doing. That's ongoing. That's not on the horizon. That's in the here. It's now my 5th year of that. So what we do have, and we just got our hands on, so this is ready to pop here, is we got probably one of the first places in North America to get what are called NK cell exosomes.
Oh wow! Okay, never even heard of this. Here we go.
Let's unravel that. So in our immune system are white blood cells that do many good things for us. We're making them. They help us out. They fight infections. They do other things. Well, a very small percentage of those white blood cells are called natural killer cells, NK cells. And those cells have a job, and their job is to, scavenge around the body and look for accidental abnormal cells like cancer cells, which we might accidentally make here and there, and they get removed. Like senescent cells, which are cells that are leaky and not working well, and leaking crap and taking up resources, but they haven't died and exploded or gone through what we call apoptosis, where they get eaten up through a process of autophagy, if you've heard that. So these NK cells are very important for us. Well, just like our stem cells, the NK cells kind of peter off at a certain age, and then you're more likely to get cancer or suffer the inflammatory damage from the senescent zombie cells. Well, as it turns out, people with cancer tend to have lower NK cell functions. So there are a lot of approaches to help treat cancer with NK cell technologies. This is called one form of immunotherapy, using the immune system to attack the cancer.
Wow.
Well, as it turns out, those cells, those NK cells, do their work through small signaling, cell-to-cell signaling called exosomes, just like I use for other purposes. But we can actually get the exosomes now from NK cells. So why is this such a big deal? Why did you do it before this? It's very hard to get enough of them, because first you got to get enough NK cells and then collect all the exosomes. So, and NK cells are so, they're the minority anyway, such the minority. So now we have access to these NK exosomes. They're hard to come by. I have very few doses. And our intention is to help make them available to people with cancer.
Wow.
And there's great evidence in the scientific literature, evidence-based, that you can kill various types of cancer cells in animals and in petri dishes. And even in animals, solid tumors you can inject, solid tumors tend to be difficult because they're sort of got, the outside, they've got encapsulated, and the tumor cells deeper inside are harder to get to. Well, you can inject, and these exosomes will do their job, and they don't harm normal tissue. So that's the beauty of this. They're
completely selective. Wow.
So we've got those. We're going to look at it to help as an alternative to treatment, as an augmentative treatment if someone is having maybe chemo and radiation, they want to add something, and then maybe as a preventative. People at high risk, maybe their parents had cancer, maybe they have BRCA gene, maybe they had cancer years ago, and they're always checking every year, and they want to help prevent it
to make sure it doesn't come back.
And then one study showed that these in humans, NK cells, not their exosomes, if you give NK cells to patients, and you can get NK cells in some clinics, mostly outside the U.S., those NK cells will help improve the age markers, blood tests on those patients, make them appear younger in their blood tests. Wow. So we know they have benefits. So skipping ahead to the exosomes has benefits because the exosomes travel better than cells do throughout the body. And the exosomes, the NK cells require to be activated, expose them to some cytokines, some little peptides to get them angry. Well, the NK cell exosomes don't require that. So they more
do their job.
Off the shelf. You couldn't ask for a better potential anti-aging, anti-cancer type of thing. So we've got those now, and we're going to start making them available to people. This is we're not allowed to make any claims yet, but
right.
But that doesn't mean you can't have them if you're interested.
No, absolutely. So again, cutting edge, right on the bleeding edge of biotechnology and biomedicine and biohacking. Incredible. Wow, that alone is that's mind blowing. As somebody who's I've had loved ones impacted, by cancer, as most of us have. I mean, people don't realize just how common cancer is. As we've evolved, I think in our medical technology and healthcare, it's funny how the things that hurt us and kill us have shifted, right? So now it's cardiovascular mostly, right? And then cancer, I think, is probably number 2. Yeah. Falling when you're old, that people don't realize. You were talking about reinforcing skeletal muscle and using stem cells to reinforce bone density, etc. Fixing an ACL. Now that ACL is strong, this person doesn't fall anymore. I mean, again, that's an indirect way of extending somebody's life.
Right. Right. You gotta keep moving.
Yeah.
So once it's not moving, it circles the wrong direction for sure.
Yeah. It's like a friend of mine told me once, that it stuck with me. Like, to survive, you have to be like a shark. Keep moving. Yeah. Don't stop. Just keep on moving. So incredible. All right. Anything else? Oh, if somebody wants to reach out to you, please tell us. How do we reach out to you if they want to get in touch? How does this work?
Yeah. Thank you. Our business is now called Recelebrate because we're celebrating the renewal of your cells. So I believe we're the only people using that term the way that I'll spell it for you on the internet, so you can find our website with that word.
And I will put all this in the show notes. So for the folks, when you see this episode, you will have all the information to contact Dr. Jeff. Absolutely.
Yeah. So RECELLEBRATE. Find us on all the social channels, LinkedIn, YouTube, Instagram, Facebook, Pinterest even. We're out there, TikTok, and our website. Reach out. We like to meet new people all the time.
Absolutely. So, hey, Dr. Jeff, it's been an absolute pleasure. And to our viewers, thank you for joining us. Please like, subscribe, follow Dr. Jeff. If you want to live a long, healthy life, reach out to him. He's extremely approachable, and I thank you for your time. And, well, everyone, remember, we'll be back next week with another episode, hopefully, and we'll be exploring more and more biohacking and trying to make it approachable and reachable for everybody, everyday biohacking. So with that, remember, assess, adapt, overcome, and Rise 41 signing off. Thank you, everyone. And thank you, Dr. Jeff.